Hello and welcome to Health Matters. I'll be your host. My name is Dr. Michael Chillemi, and today what we're going to talk about is comprehensive analysis of neck pain. I know, neck pain, so exciting. But in today's society, neck pain is critical in a lot of patients' lives. So what we're going to do is we're going to explore this topic today. And what we're going to do is we're going to take a deep dive into neck pain, the common complaints people get from neck pain, as well as what are some of your common symptoms, what are some of your common causes for neck pain, how do we diagnose it, and a variety of options to help treat it naturally, and all the other options that are out there today. So whether you're experiencing neck pain for yourself or you want to help somebody others, maybe your mother, your father, your brother, your sister, your uncle, your child, your neighbor, your coworker, or just yourself, and you want to have a better understanding of what is neck pain, then we're gonna jump right into that today. So neck pain can manifest from a variety of different ways. And the intensity can also vary from very, very minor to very, very severe pain, from little aches and pains to being severely debilitating pain. So let's start breaking down what some of the symptoms of neck pain are. So typically the first most common symptom is pain and stiffness. And that's usually characterized by either being dull and achy or sharp and stabbing. It could be located in one spot in your neck, or it can radiate down to the arms or shoulders. Some of the other symptoms that typically accompany neck pain are reduced ranges of motion. So your ability to move from forward and back or side to side are affected, and the muscles can be affected, causing you to have decrease in pain, or you're pinching a nerve and your body's locking you up and it won't let you move. Speaking of muscles and not letting you move, involuntary contractions can happen. That's when your muscles cause a creak in your neck and you got a sharp pain and you can't move and your muscles are in complete spasms or it's fluctuating in there. That could be a sign of neck pain. Tingling or numbness is typically experienced when people have compression of a nerve. You might feel some pain coming from the neck going down to your arm or fingers, or just arm and fingers. Weakness can be another sign of neck pain. If you have weakness on one side compared to the other, when you typically were, let's say if you're right hand dominant, now you're weak in your right hand and your non-dominant side is stronger, that could indicate that there's a problem pinching those nerves and it's affecting that part of the nerve, which is affecting your hands. See, the nerves in your neck control your hands. Headaches can be another sign and symptom of neck pain, whether you have migraines or tension headaches. Just going back to nerves, specifically if you have pain in either these two fingers or these three fingers or the back of your hand, those are very, very specific nerve roots that get impinged in your neck, and that can cause different symptomatology in there. That's something we want to look at. So we tend to overlook early signs of neck pain. We don't typically treat it until the pain gets worse. So we want to make sure we identify what the symptoms are and what are the common causes of neck pain. And let's talk about those causes and try to understand the root cause of neck pain. It's vital in finding the most effective treatment plans. So some of the biggest culprits for neck pain are muscle strains, typically overuse. Poor posture or sudden movements can cause neck pain and cause those muscles to strain. It's very common for people who spend a lot of hours on their smartphone or on a laptop looking down. Tech neck is real. Tech neck has been around now for about 15 years, and it is a tremendous problem that people are starting to really get, and it's becoming more and more. So I see parents now giving their little 2-year-olds their phone, and their little 2-year-olds are sitting down. So now that 2-year-old is starting there with their neck pain, and it's continuing to grow and grow and grow as that child gets older and older, because now they've been introduced to that phone so young. It's real, and it's a problem. Lifestyle factors could be repetitive motions or sports or heavy lifting that can contribute to neck sprains and strains. Nerve compression is a big culprit in neck pain, whether you have a herniated disc or a bone spur, putting pressure on some of the nerves that are coming out from the spinal cord. Typically, those type of symptoms could be pain radiating down the arm or tingling or weakness. Feels like something's crawling on you. Those are some of the signs and symptoms that you might have a nerve impingement. Other causes for neck pain could be a car accident, could be a work accident, a fall, a trauma. Anything that affected your neck, maybe you dove off a diving board. Maybe you were a kid and fell out of a tree. All these things build up over time, and those things can cause pain and symptomatology. And if you don't treat them, they can become bigger and bigger problems. I see a lot of people who do things when they're young, and things don't kind of manifest until years and years later, because the body it's kind of always compensated for it. But as we get older, you can't compensate anymore. Things change. And it is critical to identify those changes. Some of the other things as we get older, degenerative disc conditions can cause pain and problems like osteoarthritis or cervical spondylosis, wear and tear of the bone and cartilage. That can lead to chronic neck pain. Age, as we get older, we do get arthritis, our spaces get smaller. So the reason why people shrink as they get older, I don't know if you know this, but those discs that are in between the bones, they actually dehydrate. And when they dehydrate, they shrink down. So if you had this much bone here, space in between, as you get older, those spaces dehydrate and they compress. So if you have an area that was problematic because of an injury, and now you got older, and now that space decreased because we naturally dehydrate and shrink, that puts pain and pressure on those nerves. And that's something that we don't think about, but that affects patients all the time. It is critical to identify some of those conditions. Poor posture. I see patients slouching all the time or looking down on their smartphones. Posture is critical. They're always rounded with their shoulders, and it actually hurts when you sit up straight and you're in proper position. It hurts because you're not used to it. Your muscles became weak. And what we have to do is fix that, right? You have to fix those weak muscles and take care of yourself, because poor posture will lead to pain and problems as you get older. You don't want that hunch that you see those older patients that get. You want to be straight and have that good posture as you get older. Stress is a big common cause of muscle sprains and strains and spasms in your body. And stress will go to the weakest area of your body. So if you are in a stressful situation and you have weak neck muscles, and you have usually there's a box that we have on the top of the neck, and that's where most patients get their stress pain, and it tightens everything up. So how do we diagnose neck pain? Understanding the cause of the pain is critical. Understanding the patient's symptoms. So what we do as physicians is we're going to want to identify a detailed patient history, right? So how do we identify pain, and how do we identify neck pain, and how do we diagnose somebody? So getting a detailed history is critical. What happened? What started it? When did it start? What were you doing? How long have you had it for? Has it gotten worse? So many different things. Characterizing now the patient's pain. Do you have a dull pain? Do you have a sharp pain? Is it stabbing? Is it burning? Is it tingling down the arms? Do you have a headache associated with it? Finding out those characteristic pain identifiers are critical in identifying what type of condition you might have. What are some of your triggers for the pain? Is it because you move a certain way, or you sleep a certain way, or your workstation is not ideal? What have you done to replicate these pain and symptomatologies? Other thing that we're going to want to notice is physical examination. We're going to actually touch patients and feel their muscles and identify where those muscle spasms are, where those misalignments are in the spine. We're going to want to touch the actual spine and actually feel the patients and see what's going on with them. Do you have spasms? Do you have misalignments? We're going to want to identify everything that we can for that patient. We're going to check their posture. We're going to check their ranges of motion, their ability to give us normal ranges of motion. Right, so inability to have motion to one side versus the other. Maybe you can bend to the left, but I can't move to the right. It stops right there, right? So then those are all signs, right? So everything is putting ingredients into a formula of a diagnosis, right? So each ingredient you put in: neck pain, can't turn to the right, decreased range of motion, tingling down certain arms, tingling into certain things. Those are all ingredients that we're utilizing to identify, okay, what is a diagnosis that we're trying to give this patient? Other things that we're going to want to look at is a neurological assessment. We're going to want to check reflexes. We're going to check muscle strength. We're going to check sensations. By identifying the specific reflexes that change, the muscles that change, that'll clue us in into exactly which part of your neck needs to be treated. Orthopedic tests. So there are specific tests that can identify certain conditions. And when we're doing all our testing, we're going to want to incorporate those orthopedic tests to identify specific potential conditions that you might have. Imaging. It is important to see x-rays. You want to see what the bones actually look like. Do you have spurs? Do you have a normal alignment? Is your alignment, do you have a reverse cervical curve? Do you have spurs? Do you have decrease in disc space? What's happening in your spine? And then if we think that the patient might have a herniated discs, then we're going to want to see further imaging, and that would be an MRI. MRI is going to give us the ability to identify soft tissue. When you identify the soft tissue, you actually can identify the nerves and nerve roots and see if there's any compression typically inside there, which will cause you pain and pressure. While a lot of patients can have a positive herniated disc, their symptoms sometimes don't manifest until they have some kind of fall or trauma. So it's critical to identify what is happening in the spine. So we're going to typically put all that together to give us a differential diagnosis. Sometimes we can't even do lab work. If we think a patient might have an inflammatory condition, we would want to do lab work to identify those conditions or maybe an infection. So typically we're going to put all those ingredients in, and that's going to give us our differential diagnosis for the patients. That's typically how we're going to identify and diagnose patients. Analyzing those findings, finding the possible cause, whether it's a sprain or herniated disc or radiculopathy or something else, it is critical to focus in on the diagnosis for that patient by putting all those ingredients into your formula so you can really analyze what's happening. You also want to identify risk factors for patients, where it could be age, occupation, history of previous injuries. It is really critical that you talk to a professional, whether that professional is a chiropractor, physical therapist, neurologist, orthopedic, pain management, primary care, somebody who identifies and treats the cervical spine for a complete diagnosis. It's important to compile and discuss all your symptoms. So anytime you're going to discuss your symptoms with your doctor, it is critical. Write everything down. Write everything down, because a lot of people forget when you're there. I forgot to say this, I forgot to say that. And that could be critical into identifying what's actually happening and what started it. Reviewing all your information with your physician is important. Okay, so now you know you have a condition for neck pain. What do we do? What are your options? How do we make it better? So as a chiropractor, obviously, my first choice is always going to be chiropractic. Chiropractic has always been tried and true for the last 128 years now for conservative therapy. That's going to be one of the tried and true answers that I'm going to definitely tell you. So in starting out, rest with heat and ice is always going to be a good idea, especially during the first 24 to 48 hours. You want to reduce any kind of inflammation. So conservative therapy is something that you're going to want to look at and think about. But beyond that, getting into a chiropractor, getting somebody to analyze you is very important to get the proper help. This way we can get you treated in the most efficient and effective time frame. Get your spine analyzed and adjusted, and getting the pressure off you, getting you moving again. That's all about increasing that function, improving your alignment. That is what we typically try to do for you. Usually we can incorporate that with therapies, physical therapy specifically. We want to help strengthen your spine. You want to help increase your flexibility and mobility. You want to put your body in a healing cycle. So the combination of chiropractic with physical therapy really does go hand in hand with making patients really improve in a very fast, efficient manner. Plus, you'll have guided exercises and stretches and specific techniques for that. I know sometimes patients think, oh, I could just go online and be a Google doctor and identify, but being a Google doctor is not really very effective when you really want to get actually treated the right way. Seeing a professional is key. Sometimes patients take over-the-counter medication, whether it's ibuprofen or acetaminophen for some kind of painkillers. Those are typically can be used for some short-term pain relief, and that's up to you if you use those type of treatments. Other treatments that we're going to want to talk about are ergonomic adjustments. So your ability to sit up, proper form, shoulders back, eyes forward, hands in a good position for typing, making sure you're in a good position for your monitor, periodically taking stretching breaks, whether it's a minute every hour or 2 or 3 minutes every half hour, whatever the case may be, whatever you need. Sometimes you need to stand up and refocus. As we typically sit on the computer long enough, our head naturally goes forward. And that's typically how most patients are. After first, there are things you could see online where patients start in one position, and as time progresses, you get closer and closer and closer to the monitor. So it's important you reset yourself. Little things. And sometimes those little things are the things that actually make changes in your body. Stress management could be another technique that you look at. Incorporate mindful meditation, exercise, yoga, help relieve those muscle tensions. Those little stress relievers sometimes are what you need to kind of take a break and get mindful of them and really get your flow and your zen right. Some advanced treatments that are non-conservative, whether you want to have your medical doctors look at injections, or whether it's steroids or nerve blocks, or usually as a last result, there are surgeries out there for some patients who have significant and debilitating injuries. That is the option, usually used as a last resort. I always tell patients, do everything in your power. Do all your conservative treatments as much as you possibly can, because once you do surgery, there's no going back. But there are definitely patients that do need it. Sometimes you are injured beyond conservative care and you need the next set of steps. And it is critical you follow those steps, right? So most conservative, and then you progress up if you're not getting better, typically. That's up to your physician to help you make those determinations. So I always tell patients, this surgery is serious. Take it seriously. Be smart about it, because there's no going back. Typically, what we do in our office is we want to take an integrative approach. We use responsible pain management with chiropractic and physical therapy, and really take a proactive approach with patients and really get them a personalized care plan that treats their condition. We want to not only treat you and heal you, we want to release you. As much as we like our patients, we want to treat and heal and send them on their way. This way they're telling others about what we do and how we're, typically a little bit different. But it is important, if you're not in my area where you can receive our help, you find somebody. So we're in North Jersey. So if you're pretty much anywhere in North Jersey or Central Jersey, then we're close enough that you can get here. We can help you. We're happy to do it. If not, go see somebody else. There's a lot of really, really good doctors out there. And find someone who can give you that individual attention and individual approach to your condition. Ask those good questions. Have that full understanding of what's happening. The better questions you ask, usually the better treatment you'll get from most doctors. It is important to be your own doctor per se, meaning be proactive in writing down all your signs and symptoms. Be proactive in writing when it started, what's happening to you, how you've changed, what you've done. All this information helps the physicians give you better information. It is important that you discuss all these different things with your physician. I want to talk about this information that I'm giving you here today is meant to be just that. It's an information for informational purposes only. My opinion reflects my understanding, and it is my opinion only. It is not intended to replace professional medical advice. It is not intended to diagnose or treat you in any way. If you are experiencing neck pain or any other condition, it is crucial that you consult with a qualified healthcare provider. And that someone can help you with a specific plan for you. Always seek the advice of your physician for qualified information. This is just information. My information, my opinion. I'm going to leave you with this. Life is short. Don't let debilitating or neck pain stop you from living the life that you want, the life that you should have. Don't let that be a factor in what you don't do or the choices you don't make. You don't have to suffer in pain. There are a lot of solutions out there, and we treat them every single day. So if you want our help, we're healthspanwellness.com or 973-759-3020. Somebody can definitely help you. Life is short. Be there healthy because you need to take care of your health. At the end of the day, health matters. And again, my name is Dr. Michael Chillemi, and please pass this along if you know somebody that has neck pain and you think this will help them in any way, even if it gives them just one thought about how to help them take the next step to feel better. Please pass it along. Stay well, be healthy. Health matters. Take care.